And Taha Attari from Smile CDR will tell us all about his experiences doing that with HAPI. He's online. And if you have any questions, you can do that afterwards through the microphone so he can hear you. Or you can also, of course, put them in the Hoova app in the Q&A session.
So Deutsch, easy.
Hello, everyone. Thank you all for joining me. Today, I'll be talking about consent services with HAPI FHIR. I'm a developer with Smile Digital Health. I've been working here for about 2 years, and I'm mostly a front-end developer, but I also work on the back end. So today I want to give a general overview first of authorization. I will lead into authorization using OAuth 2 and then consent services. And finally, how to set up consent services using HAPI FHIR with the use case very similar to something we set up for one of our clients. Most of you will likely have heard of OAuth 2 before, OIDC, Smart on FHIR. There's a lot of words and a lot of buzzwords which go around authorization. I'm going to try and demystify all of these and then contrast those with what exactly makes consent service-based authorization different. OAuth 2 is a specification which describes how third-party apps can authenticate a user without ever seeing the user's actual credentials. OAuth 2 ends with an access token, which is used to prove the application has permission to access data on a server. It is almost always a JSON web token or JOT, but this is just common practice. It's not actually part of the base OAuth 2 spec. For a Smart on FHIR application, the access token does need to be a JOT, a JSON web token, and it contains some specific extra claims and information. And lastly, with OIDC, this is another JOT, an ID token, which comes along with the access token that contains some information particular to the user who initiated the authorization flow. The end goal of an OAuth 2 flow is an access token. When the web application receives the access token, it uses it to request data. Either the user will have permission to access the data or they will not. And so what this tends to lead to is you have a pyramid of users. You have super users at the top, which have access to everything. And then you get progressively more users with progressively less access. And this works well in a lot of contexts, but it doesn't always work well for healthcare contexts. On the other hand, now we have consent, where consent-based access control is based on the data itself. And so you can be a lot more granular with consent service-based access control, since you aren't limited to whatever the initial implementation was. You can define very specific and very granular rules using the consent FHIR resource and using the consent services logic, such that you can create a variety of different consent profiles and policies for different users. And the consent services will selectively restrict or permit access to that data on a resource by resource basis. How does it get set up specifically in HAPI FHIR, which is what I'll be talking about today? It's fairly simple. You define an implementation of the consent services interface. You register that implementation to an instance of the consent interceptor and then register that interceptor to the server. It's fairly quick and simple. When does the access control happens at the start of the request and before any data comes back to the user. Just to disambiguate, there is no requirement in HAPI FHIR to use the consent FHIR resource. The logic doesn't lock you into using the consent resource itself to hold policies. However, this is a FHIR presentation and the consent resource is perfect for this task. And so I'll be using it in this tutorial, and it is what we used for the customer. Here are the main parts of the consent resource. The critical part is almost as always the patient. As we have with many FHIR resources, consent is absolutely focused on a single patient and their data. Next, we have the performer. This has all of the parties who have agreed to this policy. That's both the consenters and the surrounding organizations who agree to abide by the policy. Or that's how it's meant to be used. The organization field is for the custodian or custodians of the consent. The source is from whatever this policy came from, be it a physical legal document or simply another FHIR resource. And finally, we get to the provision. And this is where the rules themselves are really defined. And this is the part we will be focusing most on in the tutorial today. Provision has a type, which is where it actually lets you know if you are permitted or denied. It has a period, which lets you know the time period over which this particular rule applies. It has an actor, where this is the parties who are actually being restricted by this policy. Next, you have the data period, which is just the period over which the data being referred to by this policy is valid. Then there is the data itself. And finally, there are nested provisions, which have exceptions or expansions on the base policy. And so what ends up happening in practice is you'll have a consent resource with a base provision that is either permit or deny. And then you would have, for specific situations or specific parties, specific exception provisions that would either expand on that base provision for that party or restrict them further, depending on a variety of factors. This will become much more clear when we see the live example. Here is the same resource, but with the other kind of diagram. Again, the key thing to note here is that all the useful parts, at least for our purposes, for the tutorial, are in the provision and the nested provisions within it. Everything else is essentially metadata that does not affect the working of the consent. So many of you will, if you have used HAPI FHIR before, will understand it has a concept of interceptors and hooks. The consent interceptor does not explicitly tell you what hooks it runs on, but essentially there are four. Three happen before the resource is returned and before any consent-based flow happens. And before any consent-based authorization happens, and the fourth is after the authorization flow, the consent services flow is complete for auditing purposes. And the first one is at the start, when the server just receives the request. The second is right when it is selecting which resources to return to the user. The third is while loading resources to be serialized for the user. And that fourth one is just on success and failure for potential auditing or other post-consent, post-authorization activities. here are some actual code samples. And so you can see the start operation method. This just runs at the very beginning and is used to filter out if the request itself needs to go through the consent flow. Next, we have can see resource. And this is the one which processes resources when they're being selected, but not yet loaded. Third, we have will see resource. This is right when the resources are being loaded, but before they are serialized to be returned. And finally, complete operation success and complete operation failure, where you could write an RTL entry logging any other post-consent activities you might want to go through. And finally, this is just another diagram with the sequence, so it's clear. We have C1 to C4 for consent. A1 and A2 are just where the authorization hook into the same flow. And so you can see that sometimes consent and authorization occur at the same time. Sometimes they don't. And so here's the use case. I won't go to the trivial one for now, but straight to the more complex one. Imagine that there is a patient who is a member of a peer organization for the month of January. They leave over the month of February and then join back in March. And so the peer should not have access to the patient data in February. And so this would be how the authorization works. The pair would attempt to access the endpoint. The endpoint would look into the interceptor, try to figure out whether or not the patient, if the patient was a member of a pair during the time period for the data which is being requested, and allow them if they are and deny them if they aren't. And now I'm just going to share the actual consent resource here, so it's clear what it means by allowing and denying. So here is the consent resource that I'll be using. And I've tried to keep it simple, so I've stripped out most of the unnecessary fields for the purposes of the tutorial. And as always, we start with a patient. And we have a performer. In this case, just the patient, since I haven't added a reference for the organization for the sake of simplicity. And here is the provision, which is the important part. And so we start with a base provision of deny, which implies that the pair should, as the basic rule, not be able to access the user's data. And then we have the nested provisions with type permit, which show the specific time periods over which the pair should have access to the user's data. And so here we have an actor who is the provider, in this case, the practitioner, representing the data accessor. And we give them access from a start to an end of January 1st, January 31st. And then second, we have another permit block, which gives them access from March 1st onwards, since the patient is still a member for this time. And so the consent interceptor would read that and figure out whether or not they can access. As you saw, every time the pair leaves, the consent would update the provision to end the permit period. And whenever they come back, they would add another permit period and continue. They'd add another provision and add a permit period and continue. Here are the resources I'll be using. I won't be using all of these. I'll keep it simple and just have encounters, patients, one patient and a consent. And so these are the other resources which I'll be creating. Here's the practitioner, just for the sake of access. And here are the encounters, which will represent the data which is being kept, upon which the consent policy will apply. So we have an encounter in January from the 3rd to the 5th. We have an encounter in February from the 3rd to the 5th again. And we have an encounter in March, again from the 3rd to the 5th. Just going to send this in. And of course, there's a patient for which everything refers. And so here is the implementation of consent services. Oops. Implementation of consent services. And so these are the same methods I showed you earlier. So I've made my own implementation, my consent service of the iConsent service interceptor. We have in the beginning the start operation method. This one will only run the consent flow for GET requests. And so I've put in an if block here, so it only proceeds to the next consent hook if this is a GET request, because we are currently only restricting access read requests. In any other case, it is automatically authorized and doesn't need to go through the rest of the flow. And now we have can see resource. And so here, first, we check to see if this is an encounter. If the resource being requested is an encounter, we get the subject that refers to the patient, and we'll use that to find out if there are any patients, if there are any consent resources which apply to that patient. And this is just a quick search to find that patient, to find that consent resource. Once we get the consent resource, we get out each of those nested provisions, and we go through each of those nested provisions one by one and find out if the encounter start date that is being requested falls within the provision period. So we just check to see if the encounter start is after the start, and we check to see if either an end date for the provision exists. If it does the encounter start before the end date? If it doesn't, we assume that the encounter start is after the provision start and we proceed. And so now I'll do a GET request for the encounter. And so you saw earlier that I posted 3 encounters, one on January, one on February, and one on March. And you'll see the search set which gets returned only has the January encounter and the March encounter, not the February encounter. And the reason why I feel the consent is extremely powerful for this is because now that you've defined all of this logic, now that you've done the coding, presumably you as a developer have completed your work, you're done. But the user can always granularly adjust this consent. They can always go to the consent resource if they feel that the user should in fact be allowed access in February. They can always change this around to something like the 15th and say, okay, we should have access in February. Update the consent resource. And then when they do the search again, they should now get all of the resources. January, February, and March. And if they need to restrict it again, they can restrict it again. And it is fairly trivial for them to do so, and quite comprehensible, even for someone who isn't a developer, to understand that they're changing the periods on a date, rather than having to go through and mess around with the Interceptor to get the same behavior. Most FHIR users can probably understand these provision blocks, add new ones, change them around, adjust the references to their liking. And this makes it much easier to separate out your business rules and your logic if you use a consent resource to do so. And so that's everything for my tutorial today. I hope everything was clear. We had an overview of authorization services, what makes consent services special, the R4 consent resource, FHIR consent services, and a quick tutorial on exactly how you would go about it. One last part specific to HAPI FHIR, just in the interest of completeness. Here is where I actually registered the consent service. And so it's fairly simple. You just need to create a new instance of your consent service. I added a registry here so I can do searches, but it's not part of the consent service itself. This is just that I can search for data within the consent service. Here we have a generic consent interceptor. I registered my consent service to the generic consent interceptor, and I registered my consent interceptor to the FHIR server, and that was all that was needed to get this started. And that's everything for my tutorial today. Are there any questions?
We do have some questions.
Perfect.
What date is affected by the permit or deny period? The care date, or for example, the last updated?
Let me just go back to the code here to show quickly. And so this is dependent on your implementation. And so in my case, I used the encounter period start for the date that I'm using. As you can see, my encounter resources are extremely simple. And so I just use the period start date as the date that's affected by the period. You could use whatever you like or whichever field you like, depending on your implementation and your use case. It's flexible that way.
I have a
Okay.
question here in the room as well. One moment.
So I apologize if the answer to this is obvious, but is this at all impacted? Like, does this service and the what's been described still work independent of search practices? So does someone have to search for resources using a patient resource ID for this to work, or does this work if they're using a combination of attributes to find information about the patient and their associated records?
This always works. To the point that this is completely invisible from the user's point of view. Like like whatever kind of search I happen to be doing, I don't have enough resources to make this obvious, but whatever kind of search the user is doing, they will not know that their resources are being filtered. HAPI FHIR specifically even suppresses the total parameter. Usually it would tell you if you asked for it. It would tell you how many resources were in the result. But HAPI actually suppresses that for the purposes of consent. So the user doesn't know what's been filtered and what hasn't. And so any kind of your regular search will work, and the user just won't know what's being permitted or denied. They'll just get back what they're allowed to see.
I think that also relates to the second question in HUVA, which says, is there any reply to explicitly say that a resource was not returned because of consent denied?
No, there is no specific reply, and that's by design.
Yeah. Okay. Any question in the room in between before we continue on the HUVA? Here.
Thanks. What's the performance impact of this? Because I assume that the whole evaluation of consent happens after that everything is already loaded from the database.
So you can of course do this at multiple times, but yeah, the performance impact can be considerable if you don't plan it well. And so that's why I would make judicious use of the first method, the start operation, to make sure you only run this for your important resources and your critical, whatever needs to be private or restricted. It can be considerable.
Okay, and how do you handle break the glass situations? For example, if the patient has denied access to some data, but is unconscious and potentially dying in the emergency room and cannot, well, you get, cannot change his consent.
So that's actually the use case which came up. So that's what the customer wanted this particular consent for. And so in this case, you would just quickly add in a new provision into here. You'd add in a new period, or you'd adjust an existing period to account for that break the glass situation. And so as you saw earlier, you can just very quickly make a change to this, update your consent so that now we have access to February. Let's say that February is, the situation where you desperately need access. And now you can see that the encounter February shows up. And then presumably whoever is in charge of the consent would update this once your emergency is over. That's the benefit I see of having it be in a FHIR resource, which is trivial to update versus it all being locked up in code somewhere.
I could also imagine that a person who breaks the glass has another token that prevents evaluating the consent altogether, or not?
Yes, presumably.
Yet another, do you support search where you don't know which resources to check for consent before the request runs? Will you need to do post-search filtering on the results to only return consented resources? I think this relates to your question. Basically, can you also filter it before you send the query? I think that's the basic question.
Filter it before you send the query. I'm not sure I see how it would happen, in that there must be a link between the consent and the resources you're asking for. If that link is not part of the data, or in our case, we had a pretty obvious, subject and patient link. They were both pointing at the same patient. You could have any number of links in there with references that you would search on, but you would need some link between the consent and the data you're trying to retrieve. Otherwise, this would not work. No.
All right. I think we covered all the questions now. Online moderator can correct me if I'm wrong.
I see one more question in Hoover, unless I missed this one. Do you support search where you don't know which resources to check for consent before the request runs?
Yeah, we just did that
Yeah.
one.
Okay.
Any questions from the room? No? Then I thank you very much for your clear presentation. Good to have code on the screen on a DevDays. Much appreciated. And
Thank you.
enjoy the rest of your day. And hope
Thanks.
to see you